And that is not his fault. The institutional framework is happy and will not be released on Monday. Financing to take that back.
The isolation center where they are admitted.
Research is so crucial in promoting health generally because it provides us with the evidence and with the data for us to be able to know what we need to do, what we're doing well, what we need to do better, what we need to change. Because then otherwise we're just wasting resources doing things that don't work, maybe doing things that we think work but don't really have impact.
The focus was really on responding and reacting. But it's really great that we're here today to stop and take stock of, what are the lessons we've learned along the way? How well did we respond? How well did we make decisions that were informed? And, what are the lessons that we've learned along the way? And how are we using those lessons towards building a comprehensive framework in terms of how we handle epidemics and pandemics in the future?
How do we remove the hyper-fragmentation within the healthcare ecosystem so that people move in the same direction? We are a think and do tank, so we're not happy with leaving information that we've disseminated and we've shared it. No. We actually need to start figuring out how can we translate this, how can we move it to the next levels.
When people work together is that we avoid wastage of resources, of time, and duplication of interventions and programs across the different countries. So there's room for making better use of the resources that are available on both sides.
We also took into account the programs that were existing, that is gender and equity issues, as well as getting to see what programs were available for the vulnerable groups.
So we came up with the idea of policy levers. This diagram basically shows that this is the results and how we presented them. In research, you can always tinker and come up with a way of categorizing information in a way that helps you build a certain case. Our framework had these 5 components: financing. This is basically movement of resources, the actual operationalization of resources, provision of services during COVID services and non-COVID services, standards, oversight and regulation, and then community response and behavior. So that's basically how we wanted to look at it. So policy response with respect to these 5 categories.
I think government is able to innovate and adapt if you're able to come up with a conversation that then brings both of you to the table with common interest. Government is actually very open to working with private sector, to working with associations, to working with healthcare workers, and they do listen.
One of the biggest changes is that we're learning that we need and we must coordinate everything we do. COVID, if anything, has taught us how to do this at a whole new level. We now have a forum where we sit together, Ministry of Health, Foreign Affairs, Livestock. We sit together with Research Nacosti. We all sit together to make decisions when it comes to public health emergencies.
I strongly feel the study was timely in the sense that we were able to gather evidence about a pandemic, which was a new thing in the country, and also be in a position to be able to collect data on something that was evolving. And that just brings us back to the policies that were formulated at that time and how relevant were they to the population.
There is some level of coordination that we've seen in different pandemics and epidemics, but I think the one thing that I would suggest to do is to figure out how we can better coordinate between partnerships so that we have people doing the right thing at partner level, development partner level, government level, and at government level we're talking about national government and county government as well. But there's also a lot of private sector players who can come in and intervene and support the government to do a lot of these things.
One of the elements that I think we can strengthen, even as we talk about, especially to strengthen a pandemic preparedness moving forward, is the many pools and the many institutions that pay for care. What sort of platforms exist for them to share data that can enable efficient utilization of resources?
while the pandemic exposed us, and what this study showed was that our over-reliance on external capacity is there, it actually also opened up our eyes to the idea that we actually have a lot of internal resources that we're not harnessing simply because we're not coordinated sufficiently, especially across the entire healthcare space.
So how can MOH raise enough resources internally? I am a firm believer that there's a lot of resources internally, but we do not know where they are, and we do not know how to bring them together for the same cause. Today's session really brought home to me the value and importance of partnerships and what can be achieved when there are good partnerships between various stakeholders. And I think Open Phences is doing a really good job of trying to do that, to bring various important stakeholders to the table to ensure that we have strong and robust partnerships to help our health systems grow.